Sleep might be the most overlooked thing when it comes to preparing for and recovering from surgery. We know that there's so many aspects of surgery that negatively impact your sleep. Anesthesia, pain, anxiety, sleep restrictions like you have to sleep on your back. If you're in the hospital, the noises, the lights, the nurses waking you up to have your vital signs checked. But sleep is so important for healing. It impacts your hormones and your blood glucose regulation, and all of that can impact your body's ability to heal. So the most important thing you can do before having surgery is get into a good sleep routine. This is sometimes called sleep hygiene, and you want to perfect it before surgery, before you're bombarded with all of those things after surgery that so negatively impact sleep. So in the time leading up to surgery, there's a couple things you can do. One is get on a good sleep schedule. Go to bed at the same time, wake up at the same time, even on the weekends. Make sure your room is cool and dark and free of distractions. Use your bed just for sleeping so that you're not associating anything else with your bed except for sleep. You want to make sure that before sleep, usually a couple hours, you're not doing anything stressful if possible. You're reducing blue light exposure either by adjusting the settings on your iPad or iPhone or whatever electronic device you're using, or using blue light reducing glasses. You can have a calming routine before you go to bed, which might involve aromatherapy or meditation or mindfulness, or even something like a cup of tea that allows your body to relax and get ready for sleep. Now, even despite all of that, some people just really struggle with sleep, either falling asleep or staying asleep. If this is you and you have a surgery coming up, talk to your doctor and ask for a referral of someone to speak to about techniques like cognitive behavioral therapy that can help you work through what is causing you to have poor sleep. Cognitive behavioral therapy can also help a patient work through things like catastrophizing, where when you can't sleep overnight, you get intrusive thoughts like, when will I feel rested again? I'm going to be so tired tomorrow. And then these thoughts cause you actually to be more anxious, which then really decreases your ability to fall back to sleep. Cognitive behavioral therapy can help you rework that. Figure out strategies of what to do when you can't sleep to allow yourself to actually fall back to sleep quickly. If you struggled with sleep before and you have techniques that worked for you, let me know what they are below.